Some members of Congress are trying to make prescription drugs cheaper, but they're getting pushback from an industry you've likely never heard of. Our Joe Khalil explains.
It's crazy how much, being alive costs.
Joshin Bajaj recently went back to school to start a career as a clinical counselor. But on top of his tuition, he pays up to $600 a month for medication and supplies to treat his diabetes. He says that means he won't be able to finish his degree and afford treatment without finding extra work.
It makes me really upset because I didn't choose to be a diabetic, it just happened to me.
Bajaj has to get his meds through a pharmacy benefit manager, or PBM. They negotiate prices with drug makers, acting as middlemen between them and the pharmacies. Critics argue those middlemen are jacking up their profits by artificially inflating prices, forcing patients to make tough choices on how they're going to pay for it all. Now, some members of Congress want that to change.
The American people are tired of...
Kentucky Congressman Brett Guthrie is one of them.
And so insulin prices were $34 to $50, but the list price was like $300. So a PBM can charge you more for a copay than they actually pay for the drug. And that's what we want to try to drill down into.
The move would lower prices for seniors on Medicare by ensuring they don't have to pay extra based on where they get their care. Advocates say it would also bring more transparency to the way drug prices are set in hopes of bringing down health insurance premiums for people who get coverage through their employer. But the trade group for pharmacy benefit managers says their role is often misunderstood.
No one is forced to hire a PBM, but so many plan sponsors do because of that value that they're delivering in trying to bring down the cost on behalf of the patients that they represent.
PBMs argue the reforms could actually backfire, that the goal of transparency could end up costing patients more. Back home, Bajaj is getting ready for his next semester of school. With 2 more years to go, he says he hopes lawmakers will do something soon that could make a difference.
Any amount of help that they can do to, lessen that burden would be greatly appreciated by millions of Americans.
In Washington, Joe Khalil, NewsNation.